Smart Chiropractor Show. It is time for clinical conversations, and this is the segment where we take a moment and highlight. We've been highlighting a lot of our Axis presenters from 2021. Axis was our online event that was clinically focused, happened in 2021. We're going to have some announcements coming up for Axis 2022, so stay tuned for that. And on today's episode, we're highlighting a talk that was given by Nick Lancaster of AOMZ Diagnostics. Full transparency, I'm involved in AOMZ Diagnostics, but he discusses functional spinal imaging. If that sounds interesting to you, stay tuned for a little teaser, a little preview of what Nick Lancaster talked about in Axis 2021.
Hi, docs. Welcome to the Axis online event. My name is Nick Lancaster. I'm the CEO and managing partner for AOMZ Diagnostics. Excited to talk a little bit about AOMZ today and the vertebral motion analysis technology that we offer. So a couple different things. AOMZ, as you guys are probably familiar with, acronym that stands for Alteration of Motion Segment Integrity. Something that we're very excited about from a motion study and a functional analysis. A little bit of background here on myself. I've been in the orthopedics world for about 10 years, worked in spine medical device and also spine surgery. I am not a physician. I am more on the business operations side and technology standpoint. But some of the interesting things around the VMA and the vertebral motion analysis, it was actually started and originated in the surgical space. And so determining between decompression and fusion was one of the big applications for the functional analysis and for vertebral motion analysis. Now, what we've done is we've actually extrapolated that, taken the same technology principles, but really found a unique niche in the conservative space. So the functional analysis, understanding the vertebral translation, angulation, and disc height, specifically when it comes to chiropractic and pain management, outside of just the surgical space. So certainly some exciting topics over the next 35, 40 minutes or so. So excited to share some information on the vertebral motion analysis and VMA that we offer at AOMZ Diagnostics. So getting started here, you're going to see actually the picture on your screen is going to be a picture of the VMA itself. It is attached to a full-size C-arm. And it's going to go through a full flexion and full extension. So we'll get into some of the specifics on the technology and how the exam works as we get started. Just to start, the basics of what we look at for the ideal patient with the VMA, vertebral motion analysis, are really going to be any patients that have had an injury in the cervical or the lumbar spine. To date, we don't do any thoracic as far as the imaging. As you all know, if there's any type of motion that occurs in the thoracic region, probably have a bigger issue. So right now it is just cervical and lumbar. It's a dynamic weight-bearing motion study of the spine. So again, we're going to talk quite a bit about functional analysis. So it's much different than your flexion extension because those are going to be static, right? Just those static images. Where AOMZ currently, we do have access to bring the technology to providers' offices. So we actually bring the equipment, the C-arm, and also the rad tech to providers' offices. So there's zero footprint that is left once we get done scanning. So really the only thing that we have to do is gather the patients, scan the patients at the particular time, and we move from there. And why? We're going to talk quite a bit about this, but really building a bulletproof medical chart to illustrate objective proof of injury. And that's really the bread and butter for the VMA and the functional analysis that we provide. So moving on, this is kind of the understanding of what I call the three-legged stool for us. So really what we've got is we have the patient, the doctor, and the attorney. We do a lot of work in the personal injury space with the VMA and the functional analysis. For the patient, complete assessment of the spinal injuries, right? It's lower radiation. It really takes about 10 to 15 minutes for each scan, whether that be cervical or lumbar, in-office availability, and cutting-edge technology. Again, we're going to be, talking a lot about the technology and how it applies. And the biggest thing here that we talk about is going to be right in the middle, which is the objective proof of injury. So when it comes to the doctor side, as you guys can see, billable CPT codes with written AMA guidance, objective data supporting your treatment plans, correlation with the AMA disability guidelines, and it doubles the objective proof of spinal injury. And so what we look at here is spinal instability. And what we're going to dive into is really going to be, from a flexion extension standpoint, there's a lot that's missed. And actually with the VMA, we're going to have much higher sensitivity to pick up that instability, and not surgical instability, but something that we could term as being clinically significant instability of the spine. A lot of times we have providers that will have patients that will come in with minimal findings, either on an MRI or an X-ray. However, the patient's still in pain. They're sitting, standing, the pain goes away, but as they start to walk, as they start to move around, that's where that pain comes back. And so that's what we're going to dive into and what we've seen as far as the functional imaging and what the proof of injury would be on that side as well. Third leg of that stool is going to be the attorney, right? So demonstrative proof of injury at trial drives higher settlements, medically proven technology. Again, as we talked about, this was actually developed in the surgical space. So we do have about 10 years worth of medical literature that actually supports the accuracy, specificity, and reliability of the VMA functionality and the data that is driven by the VMA scan. So moving forward, again, game-changing technology. The VMA, again, standing for vertebral motion analysis, detects instability at higher rates. It really helps doctors reverse denials as well. We utilize the VMA from the private health insurance space as well. A lot of our providers either being denied care, whether that be an epidural steroid injection, a radiofrequency ablation, or a surgery, even from the chiropractic end as well, additional treatment that may be necessary. The VMA, by showcasing that there is injury that takes place, justifies that additional care. Easily integrates into the clinical workflow, and stronger science than today's tests. So really, as we talk about today's test that we're comparing to, are going to be, the flexion extension X-ray. So again, that particular data goes back into the 1940s, right? And so as we talk about flexion extension, there's really a gap that takes place. Flexion extension is great, and X-rays are great at determining, what's going on in the particular spine. But really, if we think about the flexion extension X-ray, it's a flexion, it's an extension, and it's a neutral image, and from our standpoint, what happens in between? That's a big gap from the functional side. And really, as we stand today, understanding what's going on between that flexion and between that extension is really where, the patient benefits and the provider benefits, because of the fact that now we're able to understand exactly what's going on through that full flexion and full extension. And lastly, lower radiation to the patient. So there are studies that have been done with the VMA as well. It's a remarkably different. It's about 30% less radiation than a traditional flexion extension X-ray. So again, all of these things add up into, the VMA should be a crucial part of a provider's Rolodex, and certainly of, patient care, because again, we're getting better data to drive better clinical decisions. So again, let's talk a little bit about the flexion extension. The flexion extension X-ray has significant limitations. So as we talk about, it's prescribed quite a bit. It's still the standard of care, prescribed about 5 million times per year. That's higher volume than a spine MRI or CT combined. So that's really remarkable considering the technology. The flexion extension still impacts, great amount of decisions. Again, we talk about surgeries here, 1.9 million surgeries per year. But there's significant issues with the flexion extension X-ray, right? So it's dated. The technology goes back to the 1940s. It's highly variable and subjective. One of the biggest studies that has been done to talk a little bit on the flexion extension side is Punjabi and White, right? And you can see the quote there saying that no useful information can be derived from the flexion extension procedure, especially in relation to the need of a surgical fusion. That's powerful, but as we talk, back in some of those previous bullet points, but it's still being prescribed. And so again, there's still a lot of value for the flexion extension, not to discredit that, but certainly a lot of gaps. And that's what we're talking, about as we dig deeper into the VMA technology, is understanding those gaps and where the VMA is really going to be able to provide some solutions for providers and more importantly, solutions for patients so that they can better understand what's going on, with their particular body, with their injuries, and really get a better solution to what exactly is causing my pain. And so we can drive better clinical decisions based off of that data. So as we talk a little bit about an alternative to the flexion extension x-ray. So as you can see here, the VMA actually will assist the patient through a full flexion and full extension.
All right, and that is a little bit of a presentation from Nick Lancaster on functional spinal imaging from Axis 2021. I'm excited about the future of spinal imaging because there is so much. Nick started to lay out some of that there. If you were at Axis 2021, you heard it all. But there's so much advancement in technology, whether we're shooting films weight bearing, that's beneficial. Of course, if we're able to shoot them through a full range of motion, that's even better because now we start to really dynamically understand what each individual is dealing with. I'll just tell kind of a personal story on this. About 30% of the individuals I saw, and I get this feedback from every doc I speak with as well, 30% of individuals in the personal injury realm specifically, they've been involved in trauma, right? There's a traumatic accident. They might have some radiculopathy, some pain traveling down the arm or the leg. But when they lie down, their scan of as far as an MRI comes back pretty clean. But when they get upright and moving, they complain that when they're at work, they're feeling the symptomatology and it doesn't match up with the imaging. That's frustrating for the patient, the provider, and certainly if there's an attorney involved. So getting that individual up in weight bearing, understanding the dynamics of what's going on with the segment throughout the full range of flexion extension can be incredibly impactful. You can check out more at aomzdiagnostics.com if you're interested. And again, please keep your ears tuned because we're going to be releasing information for Axis 2022 in the not too distant future. And I am excited about that. Jason, functional spinal imaging might not be the world that you live in each and every day, but what are your thoughts on it?
Well, I'm all for the concept of it. I mean, the reality is we are moving, and this is not just a static thing. And X-rays are wonderful to show the long-term effects of neglected spinal motion, and therefore you can see basically the accumulation of the trauma. But as you said, if you're looking at what's here, what's now, what's up, you want to see somebody in motion, in movement, and X-rays don't really do that. And I'm not sure any other technology besides visual digital X-ray these days really offers you that insight, whether it's for legal purposes or whether it's really for people to go, wow, I never knew that worked that way before. That's my spine. It becomes, they say a picture's worth 1,000 words. I think maybe a video these days, I haven't heard this statement, but a video might be worth 10,000 words. It just shows people, who they are and what they're up to. It's as detailed and specific to that person as possible. Super cool stuff.
Thank you. I think the key word there is demonstrative. I was trying to come up with it the whole time. And that being able to showcase exactly what's going on when somebody's going about their daily activities, incredibly powerful. Jason, well put. I could not agree more. And docs out there, please stay tuned again for Axis 2022. We're going to have some information on that coming up very soon. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.